all the pieces that we have, which every company has, but Zimmer has come up with this thought, and some professor has done that. Is he right? We really don't know. And maybe we'll know that 20 years from now or 15 years from now. But right now, we've had very good success for years in men, women, because we do have different sizes, and we're able to put those in. Yes?
What is the usual length of hospital stay?
Good question. Prior to the hospital, what is done is that the patient sees his or her internist, so that everything is set up, and the anesthesiologist needs to have that information, electrocardiogram, chest x-ray, and know that you're healthy enough to undergo an operation. You come in the hospital that morning, and you have it done, and you're in the hospital for about 3 days. And during that time, you start getting therapy to exercise your knee. If you're able to go home and there's somebody at home with you, and and most insurances cover a home care where a therapist and a nurse goes to the house, you're able to go home. If you need a little more help than that, then people go to a convalescence center, and used to be called a nursing home, but the way the rules have gone, most of these places now have a special section for people who come there for a week, get their therapy, and they get good therapy, because I've had a lot of people go to the local convalescence centers, and they're there for maybe a week, get going, and then go home, use the walker, and then get therapy at home. And the therapy is really very simple. It's a matter of walking, and it's a matter of lifting your knee and bending your knee and exercising that way. It's not really tremendously complex. And as soon as if you have a pool nearby, as soon as your wound is healed, in 10 days you get into the swimming pool, and that's great therapy. And you get better. And he said he was back playing in 6 weeks. Well, he was good. But at 6 weeks, we expect people to be walking, using a cane, and getting going. Their knee is bending nicely so they can sit very comfortably and stand up, and over a period of a couple of months get back to most activities. The knee is a little slower in terms of rehabilitation than a hip. The hip is a very simple joint. It's a ball and socket, and people get better pretty rapidly with that, because it's that kind of a joint that allows you to get going faster, but the knees do very nicely. Yes?
Lynn had a broken femur last July. Your therapy sounds almost identical to what she went through for a broken femur. Sounds the same.
Well, yeah, what you want to do for the femur is get walking again once it's healed up. Was that the hip or the femur itself?
I have a rod with 3 screws, one here and 2 down here.
Right, so you had the femur. Yeah, you want to get the knee moving, and you want to be walking, and maybe use a bicycle to get the hip moving.
Because of the knee.
Oh, because your knee bothers you. Well, the bicycle is a nice exercise, even if you have arthritis of the knee, assuming it's a gentle amount. We're not talking about bending way up and down, but...
I had arthroscopic surgery from a tennis injury in 1995, but I was never told that I needed therapy after that, so my leg has been stiff.
Oh.
When I finally was able to get Medicare, and I went to an orthopedic surgeon, he put me into a therapy group. They had me there for 1 hour, and they said, we'll do more damage than good, you can't do it.
Yeah, well, everybody has a different problem, but if your knee has arthritic changes and it's stiff, then maybe a knee replacement will give you more mobility. One of the problems in a knee replacement is if you've had stiffness for a long period of time, the muscles are stiff, the ligaments are stiff, and you have to spend a lot of time. You might not get full mobility of the knee ever again, even with a new knee in there, because it's the ligaments and the muscles and the scar tissue and the capsule that's all tight and holding it back. We can loosen it up somewhat at surgery, but that could be a bit of a problem, yes.
As a matter of fact, I had asked the surgeon, like after 3 months, I said, why not do my knee now as long as I'm not